Hi guys, Dr. Brad Maru, Spine and Injury Medical Center. A lot of people ask me, what type of pillow should I use? What type of pillow do you recommend, doc? That's a really hard question because everyone's neck is so different. Let me give you an example. Let's look at x-rays. A person with a reverse curve of the neck, normal curve should be arched. This person has a different muscle pattern. This one has a reversal or actually breakage and damage in the ligaments and tendons in this area. Going to be a different pillow likely. Let's take this person. Degeneration in multiple levels of the spine. And then we have, this person who's got a general-ish curve, but actually a couple acute levels of damage in the spine. Each one of these people is going to have unique presentation to their neck, unique damage to the muscles and ligaments around their neck. So everyone needs a different support. Get the tension out of there, and then we can find out what the new norm is. Do you recommend something? No, I wouldn't. But I would say shop around, and if you should be able to lay flat on your back. If you want to be able to do that, then you have to get that addressed. You have to get that treated. Hopefully this helps with that feeling that you have a never-ending search, because you do if you don't really know the pattern that your neck needs. Hopefully I can clarify why we don't recommend pillows.